Hello, and welcome everyone to Facey Community High School. I'm Principal Ken Wlos, and I'm so excited to have all of you here as guests at our amazing school. More than 1,000 amazing and awesome students walk through our doors every year, and we continue to always look for new and innovative ways to help them grow and thrive. Today, I'm proud to welcome the Government of Alberta and CASA Mental Health leadership to our school to make an important announcement that complements these efforts. Joining us today are the Minister of Mental Health and Addiction, Dan Williams, CASA Mental Health Chief Executive Officer, Bonnie Blakley, CASA Mental Health Board Chair, Janet Hancock, and Alicia Long, who is a parent of a CASA Mental Health Classroom alumni student, and last but not least, our Elk Island Public Schools Board Chair, Cathy Allen. The media will have an opportunity to ask questions at the end after we hear from all the speakers. And with that, please join me in welcoming the Minister Williams, to the podium. Thank you.
Well, good morning, everybody. I'm very glad to have you all here today, and thank you to Facey for inviting me. Thank you to Cathy, the board chair, for hospitality in the Elk Island School Division, Principal Wlos, and of course, all the Fly students, the Facey leadership kids that greeted us on the way in. It was wonderful to meet you all in passing, and it's great to see the work being done here at Facey. I want to also thank Alicia for the story that she's going to share with us afterwards. It's often very vulnerable and difficult for families and parents to share on this topic, but she deserves a special thanks from all of us here and for our province for being willing to testify to the importance of talking about mental health in our classrooms and in our families. Alberta has seen an increase in challenges around mental health and addiction now, especially coming out of the pandemic. And particularly when it comes to support in schools, our government has recognized the importance of making sure that students have the best possible care that they deserve, and making sure that teachers in the school system are doing what they're meant to do there, which is teach and educate our kids. And in that spirit, the government announced in our campaign that we would be building and starting up 60 mental health classrooms with CASA Mental Health Classrooms. These 60 classrooms, with the announcement today, we've now reached approximately 1/3, with 9 more operating this school semester. This is an additional investment over 3 years of $70 million that allows us to care for students like we see here in Elk Island School Division, and particularly here at Facey. Facey is one of the many recipients of these mental health classrooms that we think are so terribly important. The truth is that with the difficulty and the challenges around mental health, we know that kids need to be wrapped around with services where mental health classrooms, like the CASA classroom, are going to have supports from psychiatrists, from psychologists, from physicians, from nurses, registered psychiatric nurses, and obviously from mental health therapists and teachers as well. These dedicated classrooms are there to help children so that they can transition into their classroom, get them into a spot where they have an opportunity at recovery as well. In spite of the mental health challenges, they should be able to operate and continue to live a full life as a family member, as a friend, as a member of this community at Facey, and every other school across the province of Alberta. And so that is exactly the goal of what we're doing here in this Step Up and Step Down program that you're going to hear more about from Bonnie when it comes to what CASA offers. They've been tremendously successful, both in terms of what we understand anecdotally, which we'll hear today, but also in terms of what we're hearing back from the school divisions as feedback and their results from it as well. So I couldn't be more proud to be here working to announce these programs that are starting. Facey, of course, we have the new classroom started already with students already set up and the classroom in operation. We have St. Joseph Catholic High School in Edmonton, Roslyn Junior High School in Calgary, Junior High School in Calgary, Bishop Carroll High School in Calgary, the St. Cyril School in Calgary, Senator Riley School in High River, the Pines Alternative School in Red Deer, St. Gabriel School in Fort McMurray, H.E. Bourgon School in Bonnyville, and this gets us to approximately 1/3 of our way of a goal of 1,500 students being cared for at CASA Mental Health Classrooms across the province, and access to Albertans, no matter where you are, where you attend school, for an opportunity at recovery for your children and for your family if they're challenged with a mental health issue in their home. So with that, I want to thank you for your time, and I'm happy to invite up Bonnie next. Thank you very much.
Good morning, everyone. Thanks for the invitation. Thanks to the school division, to the Bev Facey School, and all of the staff here. A special thanks to the youth that are in the room. I have 7 children for those of you in this room, and I'll call you young adults. I don't know if that's how you want to be heard, but my kids always asked to be that once they were in high school. I want to thank you for your welcome and for your enthusiasm about having us in your school. I'm Bonnie Blakley. I'm the Chief Executive Officer for CASA Mental Health. And we want to tell you that CASA, during the pandemic, realized that we were going to have to show up different. More than ever before, we were seeing what was happening to children, youth, and families at home, at work, at school, and in our therapy rooms. And our decision was that we needed to transform. This change has focused us on delivering more services to more kids closer to where they live. We recognize there's a higher level of need and more kids and families needing us to support them. The thing about CASA is we don't do prevention, promotion, or primary care. We have partners in the community that do that. And CASA doesn't do emergency response services or hospital services because we have Alberta Health Services and now Recovery Alberta helping us in this province. What we do is the missing middle. We provide services to children and families who often can't get the service because they're too acute for their community or their family doctor can't manage them, but they should never actually have to be in a hospital. We say we are filling the missing middle. I'm not only the CEO of CASA, I'm a mother of 7 children, and we've experienced mental illness in our family, something that is difficult to talk about. But as a result, I like to say to families on this journey, we understand that the system is not built as a whole system. It is often disjointed programs and services, and once we get them, we often have troubles getting back to our communities effectively. We know this at CASA. We've lived it, and we're here to help change it. We try to help our families manage their way not only through their mental illness, but back to their home communities. CASA Mental Health Classrooms are part of the work we're doing to fill that gap. We say it is our way to come and help kids between their home and the hospital. We have specialized classrooms. These classrooms are modeled in a way that allows us to provide direct service to kids while they're learning. You receive individual group programming, psychiatric care, medication management, all individualized for you specifically while you're in that classroom. We also support caregivers and the home schools that many of you might come from to access that classroom. We make sure that you're supported in a smooth transition back, because we know that once you're stable, you want to go back to your community, your friends, and your schools. It's about making sure children and youth have a circle of care built around them, because we know you and your families deserve better. Feel like we're doing some pretty cool things here. I was just mentioning to the minister, I'm a grandmother for the first time. And what I recognize is that the services our kids didn't get, Alberta's doing to make sure that our grandchildren will have. We're doing something special. 9 new classrooms are open. We now have 1/3 of our classrooms opened across the province, and especially special for us because we're now in Calgary and northern communities and now have a presence everywhere across Alberta. As the minister said, once we have our 60 classrooms, we'll serve more than 139 communities and more than 1,500 children a year, and youth and young adults will have the access to the services as they need them. But behind every one of those numbers is a story, and every one of them is a child's life and their families. We're just so pleased to be part of this journey. We want to thank the Ministry of Mental Health and Addictions, the Ministry of Education, and all of our partners for being on it with us. And I would fail my team if I didn't say, if you want to know more about CASA Mental Health, you can go to casamentalhealth.org. You can learn more about us. If you're a youth in the room and you want to volunteer, we have lots of opportunities. If you're someone who wants to give back and donate, we have a back to school campaign coming to bring even more services to children and families. Thank you everyone who's here, who sees the same vision we do, to have a community where all children, youth, and families are provided with timely mental health services and are empowered to thrive. I'd like to welcome our board chair, Janet Hancock, to say a few words.
So I was a principal with Edmonton Public Schools and a teacher for over 40 years. It's hard to believe because I look so young, right? Ha ha. Anyway, I started my career at Sherwood Heights Junior High School. Did anyone here go to Sherwood Heights? In Sherwood Park? No? Okay. And I have lots of good memories about working with this county and so on. And what I wanted to talk to you about today is the importance of mental health classrooms. And I look around at youth in the background, young adults, as Bonnie said. And I just want to talk to you about my own story with children's mental health. And that is from the perspective of first being a teacher and then being a principal. And what I found as a teacher is that I wasn't equipped to help students in my classes who had significant mental health issues. I did my best. We had counselors in the school. We were able to make referrals, do whatever we could to help. But it really wasn't hitting the mark. And when I became a principal, one of the things that I learned that I could do was to assist kids on a broader level. And so I was junior high principal first, and I worked with some other junior high schools. This was in Millwoods. And we were able to put together a project. It was called the Way In Project. And one of the interesting things about that project was we were able to create a mental health classroom for our 3 schools. And we had a lot of initiatives going on among our 3 schools, but what we found was the most important initiative that seemed to take over was this mental health classroom. And one of the great things about it was there was no stigma around the idea of kids asking for help. It would be very unrealistic of us to not be open about the fact that all of us at some time in our lives experience mental health issues, myself included, all of our families. And we sometimes need that support. And one of the things about the mental health classroom that's really cool is that it's a transition type program. So if one of your friends, for example, is really feeling so much anxiety that it's hard to go to the regular class, they can take that class in the mental health classroom, and when they're ready, they can go back to their program. And that's the beauty of that program. And at the junior high level, one of the statistics that I remember is that we had 36 students who went through, over a period of time, they went into our mental health classroom and went through that project. And of that 36, 32 graduated and went on to high school. And, you know, that was a pretty big statistic for us because it meant that we were having an incredible success rate. So I'm here today because when I was a principal at the high school level, I also set up a mental health classroom. And I love that work. And I think that work is really important. And when I go out with Bonnie, we go out and we talk to groups and we talk about the importance of mental health. We talk about the need for supports. We often have people line up, adults will line up at the end of the meeting, and they'll want to talk to each of us about their own stories. And the biggest thing that they say, and this is why I'm so proud of the government of Alberta for helping us with this initiative, because we couldn't do it without them. What they say to us is, if only there had been support for my child when he or she was in junior high or high school. And that is very affirming for us because it tells us that we're on the right path. So my message here today is just to say that I am a strong believer in going right into schools, helping students where it's needed, right in the school, and working very closely with professionals to do what we can to make the world a better place. Bonnie said, if you guys want to volunteer, please give your names to, one of your teachers and they'll pass it on to us. But we're doing great work. In the Edmonton area, we have reached 8,000 children and families, and our programs they're free, and they run from ages 3 to 18. So thank you to the Alberta government for this wonderful announcement and the ability to have mental health classrooms right across Alberta. Thank you.
Good morning. My name is Alicia Long, and I'm a mother of 2 wonderful children. In the past, my daughter had a terrible traumatic incident, and it left her with mental, emotional, and physical distress that we as parents were completely unequipped to assist her with. We used many support resources throughout Alberta, one of which was CASA Mental Health, and more specifically, the CASA Classrooms. The CASA Classrooms offered a unique blend between a school environment and guided therapy. It was a healthy space for my daughter to both learn and to grow in. In CASA, my daughter gained a multitude of skills to cope with her emotional distress. She was shown how to differentiate external and internal problems, work through fears and anxiety that held her back, and was given a safe environment to practice socially acceptable interactions. Therapy sessions were embedded right into her classroom schedule so that my daughter always had a safe space to talk about her complex feelings. The sessions included group therapy and one-on-one therapy with a professional where she could tackle problems that were very specific to her. They taught her how to be a better advocate for herself, even. She was shown how to navigate difficult topics that even many adults have a difficulty expressing properly, such as, "You're making me angry because," "My social battery is low," and the one that we always hear, "I need a break now." The staff worked to create a multi-layered approach to learning and development. They kept in close contact with us as parents at all times. We worked out solutions that could be implemented both at home and in school. This gave our daughter a very uniformed approach to assist her in her growth. She had a circle of caring professionals around her that we as parents felt very empowered by. The staff worked tirelessly to cover relevant topics every week. The topics spanned from current difficulties she was facing to future concerns that could arise. Thanks to the staff, we now know where to find resources in the future if needed, and we have more confidence to raise a teenager who has experienced trauma. In addition to emotional skills, our daughter has dramatically improved in her schoolwork. In fact, she gained 2 levels in reading and math proficiency, and her confidence in trying new and difficult topics has grown tremendously. My daughter's CASA classroom created a room full of strong bonds that all the students have become friends. It's been incredible to witness their growth together, both socially and emotionally. The CASA classroom has been a great success for our daughter. And I'm honored to be here today to help announce this next rollout of this amazing program so more families who need the help get it. Thank you for giving me this opportunity to speak about our wonderful experience with CASA. Thank you.
Good morning, Minister Williams, Superintendent Stoddard, the CASA folks, Elk Island Public School employees, and other esteemed guests. Thank you very much to the Facey leadership students. You are genuinely proud of your school. And it was such a warm welcome that received from you, and Principal Wlos is so proud of you. He talked you up while we were gathering in the other room. I am very pleased to welcome you to Sherwood Park this morning and excited to celebrate the opening of the new CASA classroom here at Facey. As is clear by the work of those from Alberta Mental Health and Addictions, Alberta Education, and Alberta Children and Family Services, this initiative is an excellent example of what is possible when those with the best interests of students and the skills and resources collaborate to change direction for the better. This is not an issue schools can solve on their own, or even a single department in the government. I applaud the Government of Alberta for the steps it has taken to bring all the parties to the table to address what amounts to a crisis for many people in our province. Our administrators and teachers have seen firsthand the challenges students are facing right now in terms of their mental health and well-being and the impacts on their educational experience. Many students are facing pressures and difficulties in their daily lives that make focusing and achieving on school very difficult, and they need access to a continuum of essential mental health supports to be able to grow and thrive along with their peers. I want to acknowledge the exceptional work CASA has done to bridge student mental health and academic needs, and the compassion and the care they've already demonstrated here at Bev Facey. We are so grateful to the Government of Alberta to be one of the 8 new CASA classrooms put into operation this school year. Each classroom represents an investment of therapy and care that will pay real-life dividends for students, their families, and the community overall, in the form of health, happiness, and ultimately academic and personal achievement. Thank you.
All right, thank you, everyone. We'll have an opportunity for media to ask questions. I see Shaylan quick to front of the line. If you can state your name and outlet for the record, we'll do one question, one follow-up.
Thank you so much. It's Shaylan Skalski with CTV News in Edmonton. Minister, I'm wondering why provide funding through this organization instead of going directly to school boards so that they could hire these professionals at schools so they could scale it to serve more students?
Well, we partner with CASA because CASA has a terrific track record as a non-for-profit operating in Alberta, and they have an expertise and resources that I think, as we heard from the superintendent, no one school division can solve this on their own. We want teachers to be able to do their job. They're incredibly compelling and committed teachers that care for the welfare of their students, but they are not a psychiatrist. They need to have that support. CASA has both administrative and proven patient delivery in their experience in the CASA House, and we've partnered with them to great success. And I've had nothing but rave reviews, to be perfectly frank, from every school division. Aside from that, the province of Alberta also has, towards the end of COVID, has continued now to extend a pilot project for mental health supports for school divisions across the province. That, as a separate pot of money, is continuing on. It's funded through education, not mental health and addiction. We are truly trying to do all we can to address the mental health challenges and, quite honestly, mental health crises that we see in families. This is sort of filling that, as we heard from Bonnie, that middle, filling the middle where we don't need necessarily inpatient psychiatric supports for these children yet, and they're not operating at their best potential in the classroom. What they need is that step in between, and CASA has great experience on that, bringing together all the different relevant professionals into one classroom so we could truly do professional wraparound support.
Just a follow-up for you, and then another question, I think for Bonnie probably. How does the government choose which schools will get this funding that'll go through CASA? And then I guess to CASA, in terms of how students get selected, do they apply? Do parents have a say? Do teachers get involved? I guess talk to me a little bit about the mechanics from that perspective.
Sure, I'll invite Bonnie up to answer as well. From my perspective as a minister, I want to see every single part of the province get access to these services. So we've come up with a plan where we work closely with CASA about rolling out these into school divisions that are welcoming to have it. We want to create a geographic blanket across the province and also make sure we have capacity. You know, Edmonton and Calgary, obviously large centers. We need to have a number there, but also we need to have Fort McMurray, et cetera. We've already been in conversations with other specialized school, whether it be Northlands or Francophone communities, to make sure they also get access to this. And we're learning from the first years we've rolled it out, the best way to do that. It should be, I mean, as far as I'm concerned, an unofficial motto is every Albertan deserves an opportunity at recovery. That includes our students in the classrooms. And that's where we're trying to have a geographic and constituency, no matter what variety of education you're getting, coverage for everyone across the entire spectrum. Bonnie, I'll let you expand.
So the minister nailed that first part perfectly. We're working with all communities, and the idea was we took health data, community data, sort of looked across the province, and what we saw is that if we could strategically place approximately 60 classrooms it would actually service 139 communities. And if you think about this as being that middle, this is intervention. These young people have often already seen some level of service, or maybe they've already been in some other programming, and it's just not a high enough level. And unfortunately, so many of them end up going to a hospital then, so we're trying to prevent that. So you'll see that really being the key of this, and so that 1,500 children annually. The thing with how we get referrals, they come through the schools is what we're encouraging. Families can talk to their home school that they're in, and then that home school can then help them with the referral process. If you're unsure, you can go to casamentalhealth.org, because we also will help families with the referral process. And we also see family physicians who are starting to understand about the program as we roll it out, and primary care networks also doing referrals. So ideally through your home school, though, that's the easiest for us.
Okay, perfect. Next to the mic.
Hi there, Jacqueline Cusi, Global News. Yesterday, Leduc had announced a new policy for better supporting homeless population. And of course, mental health really ties into homelessness. That's one of the key issues that comes to it. They said that they're pushing the province to develop a regional homelessness policy. Is there that homelessness policy in the works right now? And what can you kind of explain what we have right now of that?
So the province of Alberta takes very seriously homelessness, of course. Minister Nixon, the minister responsible for this, would be the individual that would be the point person on delivering the program going forward. I think that there's a huge intersection between homelessness, mental health, and addiction. And we need to be able to work not in a siloed way, but collaborating between different ministries. A good example of that is what we've seen in Edmonton with the Navigation Center. We saw encampments that were causing personal harm to individuals. These encampments, that's a euphemism. They're run by violent drug gangs often that threaten individuals. Violence takes place there, sexual violence. There were weapons found. I mean, they're straight out of Lord of the Rings with the swords that were 8 feet long. It was not a pleasant place for people to be. And so the government took action. And so we intervened with the Navigation Center there as a way to help people. Once their encampment's taken down, they need to have a resource to go to, where we put everything from Service Alberta and IDs to virtual opioid dependency addiction treatment programming, to recovery coaches to bridge that on forward, to help with finding accommodation and housing for people. And so we're looking at scaling that up across the province as well, working with communities. I work closely when it comes to the addiction file with the mayor of Leduc, and happy to continue collaborating with mid-sized cities that have been particularly burdened with this problem, which hasn't been the case for much of Alberta's history. So I want to work closely with them to make sure those solutions are ones that work for both the local municipality and are also ones that we can support at the provincial level.
Is there a specific policy that is in the works right now that addresses all of this?
So the entire approach to the recovery model from my side of mental health and addiction is addressing the interface between homelessness and mental health and addiction. And I'm collaborating very closely with the Minister of Justice, the Minister of Seniors, Community and Social Services, the Minister of Public Safety and Emergency Services, the Minister of Children's Services, amongst other Cabinet Committee members, to make sure that our policies are aligning. And if you want to have more particular answers on Leduc and the question around homelessness there, I'm happy to get you contact information from Minister Nixon's office.
Thanks.
Okay, any more questions here in the room? Oh, sorry.
Hi, Theodora McLeod with Sherwood Park News. Ms. Blakley mentioned getting support through AHS, and I think we know that, well, mental health can sometimes be contained. Sometimes you do need support that goes a little bit further. With all of the talks about AHS funding, AHS switching to Covenant Health, or our funding switching to Covenant Health, is there any contingency plan or anything in the works to guarantee that no matter what happens, these kids are going to get the support beyond CASA?
Yeah, absolutely. I can guarantee these kids are going to get the support beyond CASA. We have just established Recovery Alberta. It was established over the summer, legally created, and then on September 1st became operational. Recovery Alberta is the successor to mental health and addiction within AHS. And this organization is now focused on mental health and addiction across the entire continuum of care. So that body is funded to approximately $1.13 billion. That funding has increased will continue to increase. We know that mental health and addiction supports are going to continue to be a priority in the future. I mean, 5 years ago, we didn't have a minister of mental health and addiction until was appointed under Premier Kenney in 2019. Danielle Smith created a full minister, not just an associate minister. So I now have huge responsibility and resources now to continue supporting mental health and addiction across the province. The creation of Recovery Alberta is one more step in that. We're not doing mental health and addiction healthcare off the side of a desk. This is a priority for the province, and CASA, this investment of $70 million for up to 60 schools, and these now 9 more starting this fall, are a good example of us putting our money where our mouth is, making sure that we're providing the care that students deserve and that opportunity at recovery.
Perfect. We have time for one more.
Thank you. I know you talked about glowing reviews that you've heard since rolling out this funding last year, but what evidence do you have that these CASA classrooms are actually working? And if you don't have that evidence, I guess what parameters will you be using to ensure that it does?
Yeah, I'm happy to let Bonnie talk a bit about the metrics that we're using in terms of students going through. What we heard from Alicia and her story with her family are one of the few alums that exist. We've had it a number of schools. These are 9 adding up to 17 now total. So we're really getting going. We do have information from the school division in terms of their report back in terms of success rates, and we're looking to continue. I'll let Bonnie speak a bit more to the metrics.
So first and foremost, these classrooms are medical classrooms. So like any health professional, we have all sorts of metrics related to their medical outcomes. So there's individual metrics for the individual child, and we often will work with the families to determine what those things are that we want to achieve with that individual child. So we track all those. We have all sorts of tools we use in mental health. There's a thing called the Hancock tool. But just so you know, there's tools that we use to identify where you are when you come into a program, and then through the therapy and training and skills you develop, how you feel when you're leaving. We also talk to both parents and children about how they feel that went. So there's quantitative and qualitative metrics on every one of our programs, and we have all sorts of logic models and all sorts of fun things if you ever want to see the program outline, because we really do. This is a medical, and we want to be able to not only track for the kids' success, but also so that we can learn what's working for these individual kids and what we need to change. In addition to that, we work with education because we're helping those kids, and you heard from our parent that we also want them to academically advance. Our goal is to stabilize them so that they can advance. So sometimes while you're in the classroom that semester, you might not, but by being stable, you see oftentimes that those kids then start to advance in reading, writing, and other things. So we track both their education attainment and progress as well as their medical.
Okay, perfect. We'll jump to the phones, check for questions there. Operator, do we have any questions?
No question over the phone. Please proceed.
Perfect. Thank you. That wraps up today.
Oh, okay. Thank you, everybody.